Well, tuberculosis can definitely affect the growing fetus, the unborn child. In the first trimester, the first 3 months of pregnancy, there is an increased risk of miscarriage. Later on, there is a risk of premature delivery. A premature baby being born at 7 to 8 months is at much higher risk for complications such as septicemia, jaundice, or any infection. So this is a thing that should be avoided. Another thing that can happen is that we can have a delivery at term, but the baby is born with growth retardation, IUGR or intrauterine growth retardation. That is a small foot-8 baby. The baby born at term weighs less than 2.5 kg, which is, well, IUGR, or it could even be less than 2 kilograms, which is severe intrauterine growth retardation. And once again, IUGR babies are small in weight, so they don't have the strength to, well, fight adverse circumstances, including infections. These are the risks to the baby. Now there is one more risk, but that is very rare, and that is that of congenital tuberculosis. Congenital tuberculosis is TB of the baby that takes place because of spread from the placenta and the uterine fluids, or because of spread at the time of delivery through the uterine passages. Extremely rare condition, no doubt. There are hardly 300 cases reported in the world, but the mortality is as high as 50%. It is difficult to diagnose, it's difficult to treat. There are certain criteria which are sometimes met, sometimes not met. But one should remember that if we treat TB in the patient, diagnose it early, treat it properly, then all these problems can be prevented. So the aim of the whole exercise is to diagnose tuberculosis in the pregnant mother well in time and give her complete treatment to prevent any adverse effect on the baby.